So the benefits of low-dose radiation is it's completely non-invasive and there's no downtime. Surgery is going to be the more permanent fix for any sort of severe arthritis pain, but depending on which joint is replaced, you can be down for anywhere between 1 week to 4 months, depending on what joint is replaced. And a lot of people have some older patients that are actually still taking care of their family, and they can't afford to take 4 to 6 weeks out to actually have their knee replaced. And so what this radiation does is it provides an option that is non-invasive with limited interruption of the day to still provide significant pain relief. The same thing with having a joint injection. A lot of people are afraid of needles or don't want a needle injection, and for a lot of people, a steroid injection into the joint only lasts maybe somewhere between 2 weeks to maybe 3 months at most. And so this provides a non-invasive option that provides, according to the data, more of a durable pain control, more of a long-lasting pain control, somewhere in the order of 1 to 2 years ideally.